Hi everyone, my name is Whitney and I am a dental hygienist. If you're new here, welcome. If you've been here before, welcome back. Let's talk about your teeth during pregnancy. And before we jump in, let me quickly remind you about my website, teethtalkgirl.com. If you're ever looking for a specific dental topic, I have a search bar where you can easily find what you're looking for, and also my Instagram at teethtalkgirl. For years, decades, generations even, there has been this theory that being pregnant puts women at an increased risk of major dental problems. A lot of women say things like, I never had a cavity until I got pregnant, or I never had any problems with my teeth until I had my baby. Is all of this a coincidence, or is there really a link between being pregnant and the health of your mouth? Does the baby really steal your calcium and ruin your teeth? This pregnancy rumor is actually 100% false. Babies do not suck calcium out of your teeth or cause your teeth to weaken, but there are factors caused by pregnancy that can impact your tooth enamel. Just don't blame your baby. Now, there is one condition that you might see that is due to being pregnant. Pregnancy gingivitis and pregnancy tumors are a hormone-induced dental condition that occur in some pregnant women. Even if you have great oral hygiene habits, you might start to see your gums swell up or develop bulbous growths along the gum line. These pyogenic granulomas that cause the pregnancy tumors are because of the changing hormone levels in your body. Although sometimes scary to look at, they are not dangerous and they are usually temporary. Most of them will go away right after you have your baby. What most expectant moms don't know is that your dental health can impact your baby. So it's the other way around in the dental world. Your baby is not impacting you, you're impacting your baby. So it's extra important to be giving extra attention to your teeth and gums before pregnancy starts and develop a good daily oral hygiene routine, including brushing and flossing. You should be visiting your dentist for 6-month checkups before, during, and after pregnancy. There are plenty of scientific studies out there that show how gum disease treatments can help improve your fertility. Your mouth and body are related, so it's important to limit oral bacteria long before it has a chance to affect your baby, or your hormones impact your mouth. Besides pregnancy gingivitis, there's one other issue that pregnancy can cause. Not to get gross, but we're talking about nausea and vomiting. A lot of women experience morning sickness during pregnancy. For some, it subsides once the first trimester is over. You might only have a bout of nausea a few times a week. In rare scenarios, it can even last your entire pregnancy. Now, when you think about morning sickness, we have two major dental concerns that play into your health. 1, a sensitive gag reflex, and 2, acid exposure due to vomiting. Talking about the sensitive gag reflex, something as simple as brushing your teeth may seem unbearable. So you might cut back on how often you're brushing or just not brush as much as you used to. It's not that you don't want to, it's more that you just can't stomach it, literally. And when you're not brushing, you're getting more plaque buildup and more acid in your mouth, which can lead to more tooth decay and swollen gums. And then there's the problem of frequent vomiting. Stomach acid is horrible on tooth enamel. That's why we see serious tooth erosion in people who suffer from eating disorders. So similarly, if you're constantly suffering from morning sickness, the acid exposure during the course of your pregnancy can lead to faster tooth enamel damage. In turn, that can trigger teeth problems that you never had before you were pregnant. And lastly, a lot of women experience weird cravings while they're pregnant. So if you're indulging on foods that are acidic, like pickles or sugary foods such as ice cream, or just a lot of one particular food in general, there's a pretty good chance you're going to see some increased erosion and plaque development with all of that extra snacking. Dietary changes like these can increase your risk for dental problems over the course of the several months. It's not that any of this is the baby's fault, it's the host of circumstances that's creating this really weird moment in your life where your mouth is more cavity prone. And one more thing, like I said earlier, scientific data does show that the health of your mouth can impact the health of your baby. Women with serious gum problems like periodontal disease are actually more at risk of preeclampsia, a baby with a low birth rate, going into labor prematurely, and unfortunately stillbirth. However, fortunately, it is completely safe and even recommended to keep up with your preventative dental care during pregnancy, especially if you think you have gum disease. Your baby's health can depend on it. So if you're planning to become pregnant, are recently expecting, or trying to conceive, make preventative dental care part of your overall health plan. Everything from your smile to your baby's health will benefit from it. And modern research shows that women who have healthy teeth during pregnancy are more likely to have children with healthy teeth as well. I hope this video helped you. Please like and subscribe if it did. And if you are interested in how to care for your baby's teeth once they are born, I will link my home care tips and tricks for babies and toddlers in the bottom bar below. Until next time, peace, love, and teeth.